Welcome, everyone. Welcome to our webinar, Advancing Equitable Outcomes in Child Welfare, a toolkit for sustainability. I'm Julie McRae from Chapin Hall at the University of Chicago, and I will be the lead facilitator of our webinar, and I'm one of the authors of the toolkit that we are discussing with you today. Before we get started, we invite you to enter your name and your organization or other affiliation in the chat so that we get to know who you are and who is interested in this work. We also ask that you use the question and answer function on your Zoom meeting for questions that you have. We will be monitoring these questions and less so the chat. So please take advantage of the question and answer button that should be located at the bottom of your screen. And I see folks are entering their names into the chat. Thank you very much. We see some diversity in who's here today, so thank you. What we are pleased to present today represents a collaboration between Lutheran Services in America and Chapin Hall and highlights the innovative work that is Lutheran Services in America's commitment to reducing racial disproportionality in the child welfare system. The disproportionate representation of people of color who are involved with child welfare is a decades-old problem. And yet we have not sufficiently disentangled the systemic and structural factors that may contribute to disproportionality, nor sufficiently included families as partners that generate solutions. Today, we will present a toolkit that uses race equity best practice principles, a learning collaborative approach, and 6 key sustainability components to support community leaders to make measurable differences in their communities to reduce disproportionality in child welfare. The Family Stabilization Initiative that we will share with you today is part of Lutheran Services in America's Results Innovation Lab. This has already demonstrated measurable success, achieving equitable outcomes for children and families in underserved communities. We are pleased to partner to present this next developing phase of their work. Our discussion today will be facilitated by myself, a senior researcher at Chapin Hall, Samantha Steinmetz, a policy analyst at Chapin Hall, and Renata Johnson, who is Senior Director of Children, Youth, and Family Initiatives at Lutheran Services in America. We want to thank our co-authors of the toolkit, Alyssa Broxton and Dr. Catherine Casillas. Throughout this past year, our team at Chapin Hall reviewed the work of the Family Stabilization Initiative, conducted interviews, and conducted focus groups with leadership, program directors, and supervisors who are the participants in the Family Stabilization Initiative. We talked with the model developers on which the Family Stabilization Initiative is based, and leaders at Lutheran Services in America, whose vision was the catalyst for the initiative. Throughout this exploration of the Family Stabilization Initiative's key components and what was shared with us from participants, we drew out what we thought were the essence of the initiative, and this formed the toolkit. Importantly, this is just one lever of Lutheran Services in America's overarching commitment to reducing racial disproportionality in child welfare through partnership, co-creation, and results-based leadership. And with that, I will turn it over to Alicia Frerichs, President and Chief Executive Officer of Lutheran Services in America, for her welcome to all of our participants today.
Wonderful, and it's wonderful to see everyone this afternoon, and we're honored to be working in partnership with Chapin Hall, who, as you all know, is really well known in the field for advancing equity throughout child welfare. So thank you much for the partnership. Lutheran Services in America is a national network of over 300 health and human service organizations with a presence in over 1,400 communities. As the national office, our job is to cultivate caring communities that advance health and opportunity for all. And we are committed to driving social sector innovation and empowering social sector leaders toward a future where all children grow up in safe and loving homes. We started the Results Innovation Lab 8 years ago in partnership with the Annie E. Casey Foundation. We challenged ourselves to address what we call a terrible truth. Over 75% of children are removed from their families for neglect, not abuse. And that means not having reliable access to safe housing, crisis intervention, food and nutrition, healthcare, and other symptoms of poverty. And we also know that for Black and Brown children and families, these percentages are even higher. So in the Results Innovation Lab, we asked ourselves, what can we do as providers in our organizations, in our communities, and on a state and national level to address these terrible truths? We asked ourselves, what will it take to center a sustained commitment to equitable outcomes throughout all that we do? The partnership with Chapin Hall and this toolkit help us better understand the strategies to be cultivated, a guidepost to overcoming the daunting challenges of driving innovation and equity across our sector. I want to acknowledge the leadership of Renata Johnson, who's on your Zoom screen. She serves as Senior Director of our Children, Youth, and Family Practice at Lutheran Services in America. You will hear more from Renata throughout the hour, but this work would not happen without her. Thank you all for your shared commitment and interest in this work, and I look forward to the webinar.
Thank you, Alicia. All right, we have a lot of folks on the call, and we really want to get you thinking about program sustainability. So for our participants, we would like you to complete a poll. We are sharing that poll on our screen. You can see the question at the top. We would like you to think about which of these characteristics resonates with you most closely. That is, what do you think about when sustaining an evidence-based or evidence-based program? In your work at nonprofits, as decision makers, as clinicians, as funders, what comes to your mind when you think about sustaining an evidence-based or evidence-informed program? And we want you to go ahead and enter that choice by clicking it in the poll that you see on your screen. You only get one choice here, so we know this is hard. Many of you have likely been involved in building and sustaining an effort that was very important to you and your organization, and you may have run into challenges. You may currently be wanting to sustain a program or effort and need some additional strategies. So what comes to your mind when you think about what to prioritize? Okay, and we can see here the results of our poll. We can see that the majority of folks really think about community engagement comes to my mind when I see the results of this in terms of what comes to your mind in thinking about sustainability. Model fidelity is also very important to all of you. Leadership capacity and effective staffing. Effective staffing is coming in at about 4th, I believe. And so, yes, I can see how these, we have quite a diversity of experience out here in the audience. And so it makes sense that you would have run into all of these challenges when you think about your program sustainability and partnering with your communities and how important those relationships are and how you cultivate them and sustain them so that you're receiving referrals to the program, so that your staff are ready, so that your staff are responding in a timely manner. So I'm so glad to see that we have such an experienced group on the call, and thank you for weighing in on the important components of sustainability. We also want to share, and this will come as no surprise, that all of these are key components of sustainability. And when reassessed and addressed with a race equity lens, that is part of the Family Stabilization Initiative, can be seen as even more valuable to achieving that lasting change that we all hope for. The Family Stabilization Initiative was created in 2021 to support organizations implementing an evidence-based or evidence-informed program to prevent child welfare system involvement. The Family Stabilization Initiative began with a cohort of organizations in 4 states with high rates, very high rates of racial disproportionality in child welfare. The Family Stabilization Initiative brings together the cohort, this cohort of organizations, their leadership, program directors, and supervisors, with the engagement of the organization's fiscal arm, to join in a learning collaborative to apply race equity principles to key sustainability components. The LSA, the Lutheran Services in America, as the developers and facilitators of the Family Stabilization Initiative, also brought in the model developers, which in this case was high fidelity wraparound models called CARES and WISE. And maybe some of you on the call are very familiar with these programs. They brought in implementation expertise to offer the cohort specialized training and coaching to support on-the-ground activities. And this has occurred over 3 years. The leaders at Lutheran Services in America realized that pursuing the envisioned degree of change in disproportionality would require supporting its organizations to shift mindsets and deviate from worn paths that weren't working. They came together to identify themes that have been keeping their community partners stuck, despite being very committed to alleviating racial disproportionality in their communities. They recognized the learning opportunity that was broadening the view of sustainability beyond money. A lot of us think heavily about obtaining that fiscal security, broadening that view of sustainability to all of the interdependent organizational strategies and practices that you all recognized earlier in our poll, and pairing this with building equity infrastructure throughout. And these two components would work together hand in hand. The organizational leaders participating in the Family Stabilization Initiative reported having light bulb moments that, when shared in the learning collaborative, became even more impactful for them. The Family Stabilization Initiative Learning Collaborative has a clear outcome goal: to reach 500 families in crisis in underserved communities. Think of the initiative as a supporting framework that you see here, and a set of tools that can be used alongside evidence-based programs to enhance achievement and reach of the program's child and family outcomes. We have long known through implementation science that there is a formula to successful implementation, but there's been much less attention to sustaining programs, and particularly with a race equity lens.
The race equity is central to the mission and vision of the FSI and is intended to uphold each of the sustainability components that you see here. The FSI's 4 guiding principles for advancing race equity are directly addressing racial disparities by identifying and tackling disparities head-on rather than shying away from them, changing organizational culture and practices by creating an inclusive culture and implementing equitable practices to promote race equity from within, uplifting voices with lived experience by valuing the unique principles and experiences of those served to elevate their voices, and mobilizing community assets by recognizing that communities have existing resources that can be utilized to support race equity and mobilize these assets. Integrating race equity principles into the foundation of FSI's mission and embedding them throughout the different sustainability components better positions cohort members to go off on their own and cultivate environments that actively recognize and address long-rooted systemic racial inequities and current programmatic practices that are not reflected in the desired direction the field is moving. The FSI prioritizes race equity to create a sustainable and impactful model that not only is responsive to the needs of marginalized communities, but is also designed to uplift and empower them for the long term. Like the bulk of this work, achieving race equity is a goal that requires continuous effort and commitment to addressing underlying root causes. So now we're going to focus on the Family Stabilization Initiative, sustainability key components. And we'll start with building leadership capacity and change management. In the realm of upstream prevention, where addressing deeply ingrained systemic and structural problems is imperative, strong leadership is pivotal. Still, there are many nuances in the space of prevention, and providers face unique challenges. Those challenges directly shape the barriers that providers find themselves confronting when it comes to building their own leadership capacity. This slide captures some of the more common issues that were identified by FSI participants related to leadership in a prevention space. We developed the toolkit to be responsive to these barriers, moving cohort members from verbalizing intended change to effective action. Through exposure to evidence-based literature and engagement in results-based work, FSI cohort members were better able to build their leadership capacity. Leaders reported cultivating a shared vision across one's organization and its service population, fostering collaboration and promoting informed resource allocation decisions so that leadership is the driving force to address the root causes of the complex issues that face child welfare program providers. While the work itself is external facing, we understand that the work cannot be carried out successfully without addressing the support needs of the workforce. The FSI's approach to building leadership capacity and change management underscores the fundamental link between effective leadership skills and successful change initiatives. While success, of course, might take time, embracing endurance is key, as systemic change can't happen overnight. It requires consistent and concerted efforts. With community engagement, the FSI builds on and expands LSA's collaborative culture, engaging a range of stakeholders to work in a broader ecosystem to achieve equitable outcomes for children and their families. Here, community engagement is not just a nice to have or a check the box item. It is fundamental to achieving program sustainability. In conceptualizing diversity, the FSI's approach calls for one to think beyond the superficial representation of individual demographics and identities in meeting spaces, and goes deeper by more critically considering the types of assets and partnerships one's organization leverages. Dynamic partnerships may include schools, faith-based organizations, philanthropy, and the court and juvenile justice system. The larger toolkit also incorporates content to help providers think through how to build and maintain these relationships. Being thoughtful about community partnerships offers more comprehensive solutions, resource optimization, and increased cultural understanding and competence, both internally and externally. And more broadly, a diverse ecosystem offers a multidimensional, holistic approach to problem solving, thereby increasing the chances of creating sustainable solutions.
Our next key sustainability component is effective family referrals. Achieving timely referrals and addressing structural barriers among providers is key to an equity-centered sustainability approach. These steps establish the agency's dependability and value within the service community and among families. Equity in family referrals requires multiple organizational levels, from leadership to program delivery, to collect, review, and respond to their data on family referrals, and to be transparent in the achievement of equity goals related to those referrals. Key drivers for receiving sufficient referrals include cross-program connections, education and outreach, be it internal or external. Just by the nature of the FSI, silos are being disrupted, and the sites have integrated with partners help the FSI members reframe their approach to be more focused on and engaging and strengthening their community partnerships, and have tried to center the messaging in the community around advocacy for families. The referral approach should be about how the organization can help to strengthen families, and this has informed Lutheran Services in America's strategic vision. Effective staffing models. Effective staffing includes hiring from the community to better connect with and serve families, additional implementation support for staff, and learning from and incorporating staff's practical experience and real-world consequences to enhance change. Effective staffing, as you may have heard of before, pertains to the right people at the right time for the right purpose. To plan effectively for sustainability while centering racial equity principles, leaders need to proactively assess their program hiring and staffing goals. They should work collaboratively with human resources to adapt procedures regarding recruitment, training, professional development, and turnover. The FSI hires staff with lived experience, allowing them to better connect with and serve families. That experience has then in turn informed teams' perspective and their ability to interact with their clients. The results framework and equity focus are being integrated into specific programmatic work as well, as well as throughout the agency and their leadership team. Fidelity to the program model. You saw this earlier in our poll. This component not only focuses on fidelity to any service being implemented, but also on fidelity to the approach of the Family Stabilization Initiative. At the core of program fidelity, as many of you know, is the ability to reproduce positive outcomes by following a defined set of strategies or activities. Anyone, in theory, can pick up the model and be certain that intended outcomes will be realized if the formula is followed. Program fidelity is important to program sustainability. Programs that achieve their objectives, such as reducing child maltreatment, involvement with the child welfare system, improved clinical outcomes, are more likely to be supported by their organizations, by decision makers, system partners, and funders. Achieving program outcomes also makes it more likely that community partners will make referrals to the program. The Family Stabilization Initiative is different from other approaches to fidelity and innovative because it implements an evidence-based model through an equity and inclusion lens with a strong pull to keeping families together. And fidelity is not just about fidelity to an evidence-based service or program, but it's also fidelity to the FSI and the approach in strengthening families and networking and engaging with your community resources. For the initiative, leadership at Lutheran Services in America has long been embedded in the results-based work model, understanding the evidence-based service as well as the support that implementing staff need. And finally, financial investments. It was surprising to me that there weren't more of you or there wasn't more of a predominance of people in the poll that said that funding was what readily came to mind when they thought about sustainability. It is a critical component. In the FSI, financing is addressed from the beginning, taking into account consideration for the complex braiding of funding that is necessary to support both innovation and sustainability. Each of the key components helps generate resources to begin and sustain a program. In addition, there are also 3 specific financial investment levers. Start early and reassess program funding streams often. Be visible, active, and influential with your state, local and state decision makers. And clearly define startup and maintenance program costs at the get-go to better weather anything that's unexpected that occurs later on, because we know that'll happen. Financing and sustainability is complicated. It's more complicated than braided funding. And while this is not a policy toolkit that you'll see, changing financing of a program does have policy and practice implications. Grant funds do not go on forever. So state contracts are often needed for sustainability. Yet federal and state funding processes are slow. So it's common to start with non-governmental funding, as we know, while waiting to scale to more sites and ideally scale statewide. And while great grants are not as sustainable, they do offer flexibility. So this is the time for harnessing creativity in terms of who your program takes referrals from, how partnerships are developed, and how you will meet the local needs of your community. Tools such as the Family Stabilization Initiative that provided resources to implement a framework for building capacity to integrate race equity into implementation, and provided a very strong foundation for later financial investments. And now we're going to go into a very dynamic discussion. We have three panelists with us here today. Renata Johnson, who has led the Family Stabilization Initiative. She is with Lutheran Services in America. Sheila Weber. Sheila is the founder and principal of Homegrown Strategies and has been partnered with the FSI throughout. And Rebecca Kiso-Knutson, who is the president and CEO of Lutheran Services of South Dakota, and she is a participant of the FSI. So we greatly appreciate all of your expertise and the work that you've been doing over the past several years. Thank you. I'll go ahead and kick us off with a question for our panelists. The FSI and the Results Innovation Lab, as we've been talking about, they focus on reducing disproportionality in the child welfare system. So how did this influence the partners and the locations that were brought to the table to be part of the initiative?
So I can talk a little bit about that. At Lutheran Services in America, we're truly committed to really reducing disproportionality, and that fact really helped guide our selection of partners and locations within our Family Stabilization Initiative. We didn't shy away from states with disparities in child welfare, and we wanted to lead the charge to address those unique challenges faced by Black, Brown, and Indigenous families. We actually saw this those disproportionality as an opportunity to turn some of those challenging truths in the 4 states, like you said, Alaska, Montana, South Dakota, and Washington, into opportunities for leadership and systems change. Our approach is really rooted in the belief that by acknowledging and actively confronting these challenges, we can help contribute to the enabling conditions that foster positive change. And we see equity not as an afterthought or a secondary goal, but it's a fundamental and integral part of the process. And our commitment to race equity is really woven into every part of the work that we do, recognizing that dismantling systemic racial disparities requires intentional and sustained efforts. And the members in our collaborative learning model, the members in these states, they answered the call because they wanted to be a part of the change and help lead the change in their communities. They saw a need and wasn't really sure about the answer, but felt like this could be part of the answer, and they knew they wanted to be a part of it. And so participating in FSI, we really believe it positions them, it positions all of us that are participating in the collaborative learning model to be change agents at the forefront of this prevention work, and in our respective states and communities to be able to do that work, really ensuring that the policies and practices designed are informed by the strengths and the resilience of families. And in these communities, in those 4 states, FSI is not just a response to a challenge and not just a program. It's really a commitment to building on existing community strengths and trust, and then showing up for the community and families and being a model of really innovation in action, turning our intentions to impact and fostering a caring community that supports families in crisis.
That's a really good summary, Renata. And you talked a little bit about how there's that feedback loop, and that's that real partnership with the states and the organizations that are involved. And so in working with these states, can you provide any more specific examples about how their experiences have informed the work of the FSI and what you're doing to support them, you and your partners?
So I think some of the experience that they've had is really experiencing the impact of the families that they have worked with. And at the core of all of the work that we do with our families is really our core belief that families have what it takes to do what they know is right for their families and do the best for their children. And so when we are engaging families and we're looking at how we support them and support their goals and their visions, we take that strength-based approach. And I think that the collaborative learning model members have been able to be a part of that. And many of them already have a strength-based approach, but to be able to be intentional about it, to be able to collaborate across the country, across these several different states, to be able to have that backing. I think them experiencing this, like I said before, really promotes their intention and their validity as change agents and how they really want to turn the child welfare system on its head and really imagine it and reimagine it in different ways.
Wonderful. Okay, so I will go ahead and go to the next question for our panelists. Speaking of families, so we would love to hear from whoever of our panelists wants to chime in, just how the FSI has impacted families. How have you seen that? What are some examples? What really resonated with the work that we're all describing here in terms of that family impact and the difference that it's making?
So I can, kind of lead in on this one as well. I think it's always great to be able to talk about the on the ground impact, because that's why we're doing all of this. Like, we see all of the impact in other ways with our leadership within our organization. But at the end of the day, we're really looking at the impact with the families that we're working to engage. And so there's just been so many stories and so many instances where families have really felt supported. And like I said, we really believe at our core that families have what it takes. And one example is that they're families that are always told that they're going to fail all the time by several different people. And there was one instance where a father was really told that in a meeting with government officials, with county officials, with all these people, that you're going to fail. And it was our team and him being associated with the Family Stabilization Initiative and having our team really stand up for him and advocate for him and then walk alongside him as he did the work to be able to make a difference for his family. Those things matter. There's another instance where there's a father who talks about in meetings, they may say one or two nice things, or positive things, but then there's a list a mile long of challenges and criticism that happens. But being a part of the Family Stabilization Initiative, along with our care coordinators and our parent partners with lived experience, that family now really feels like the list of things that they're doing well are a mile long. And the challenges that they have continue to get shorter and shorter. And not because we're just making things up and we don't want to address the challenges, but really because we're showing up as a community and we're helping to connect them to resources, and we're changing policies and practices that have contributed to some of them being in some of those situations in the first place. We're also hiring those that are the faces of those that are overrepresented. So all of those things are really contributing to families seeing this real impact for their life and what that means. And we're really shifting the mental model, not in only how we approach families, but how we approach the system as well.
That makes a lot of sense. So Sheila, I want to sort of direct this next question to you. So you're part of the FSI because of your implementation experience and your experience in strategic planning with nonprofits and other organizations. How has Lutheran Services in America's focus on race equity informed the support and the assistance that you have provided for the FSI?
That's a great question. Thank you, Julie. I think first of all, with Lutheran Services in America, centering race equity and also centering this work through the learning collaborative process was really an important foundation. And that was really key to my role as a facilitator and a coach within this process, to be able to challenge the group to practice thinking differently together as a collaborative and as a cohort, and also challenging them and encouraging them to challenge and learn from each other as well, and really begin to develop that sense of shared accountability amongst one another to truly improving equitable outcomes. And I also think that it set the stage to really look at what's contributing to the inequitable outcomes that Black, Brown, and Indigenous families are experiencing. And that occurs from a multitude of systems, not just the child welfare system, but a multitude of systems within their communities and also within their own organizations as well. We have all been complicit in being actors in a system that's that's contributing to the outcomes that everyone is also seeing. And so we also have to really take time to step back and look at what have we been doing to contribute to this, and what do we need to challenge ourselves to think about and believe differently and do differently. And so having that centered in the process was very important. And I think having that opportunity to come together monthly throughout the entire implementation process allowed us to really challenge each other as organizations to think about at every step of the way, what are some of those beliefs that we are centering right now? What are our actions? So if we're thinking about how we're recruiting and hiring staff for the Family Stabilization Initiative, how are we going about that? Are we doing that in the most equitable way possible? What are some of the barriers that are existing in our own system that we need to address? How are we crafting our job descriptions? How are we describing these positions? How are we requiring lived experience in relation to educational experience? And are we valuing those things equitably, both in how we're interviewing and who we're looking for, how we're outreaching to recruit candidates, and also how we ultimately pay people? So it begins at every step of the way. And by building that muscle to think differently and to see where barriers to equity exist within systems, it really helps build that muscle for them to not only start to see that within their own system, but then to see it in other systems as well, and be able to advocate and speak to that when they're seeing it, and be that voice in the room for families, and also be a catalyst for systems change more broadly.
Mm-hmm. And I know, Renata, this has been a big focus, you carry through with everything that you're talking about, everything that Sheila's talking about, and Rebecca too, in your experiences with your communities. I know that we heard from some of the participants about that, that they may be existing in states where there isn't a lot of support or resources devoted to race equity right now. And Renata, you've talked about how you can operate in you have around you who the partners are, who your organization, who's with you in your organization, that you can take action on every day, regardless of where your state is coming from.
Absolutely. Absolutely. And I think being a part of the Family Stabilization Initiative and being able to collaborate without competition, being able to be honest, it allowed that environment for innovation and really learning from each other, being vulnerable about what's not working and what is working. And so we believe that accelerates the pace of change. And if we say we want to talk about addressing disproportionality, then we want to make sure that we're actually addressing disproportionality, and we're looking at everything through this race equity lens, so that we can really look at our organizations, address any bias that we may have, like Sheila said, and this toolkit and this approach has really been a proven method.
Great. That is great to hear. So Rebecca, we want to really draw on your experience, and you know, this work as Renata just sort of led us into involves bringing new solutions to communities, being change leaders, shifting mindsets and resources to drive sustainability and standing up new programs. And so, can you talk about the challenges to having to address all three of those from the start: shifting mindsets, resources to drive sustainability, and standing up new programs, all of that as you entered this work?
Sure, great. That's a great question. So I think as a nonprofit leader, what we all know about the work is that funding is critical, and that quite often the way in which systems fund programming drives what organizations are able to do. What we've really appreciated about grant funding, and I think what comes out in the toolkit, is it does provide that opportunity for organizations to innovate, to think differently about the way that their systems work, and then to use that as almost a proof of concept for their community. And so what Family Stabilization has done for us, it's helped us, you know, we sit as an executive, I sit around a lot of tables in my community, whether it's child welfare or juvenile justice, and Family Stabilization and the language we've gained through the work we've done with Lutheran Services in America has really helped us shape that advocacy dialogue within those systems level conversations to say, we hear that people young people are struggling, but what could we do differently? How can we shift our focus and our mindset in order to address those challenges differently? And to hear both Renata and Sheila talk about how working collaboratively with other organizations who are operating outside of your system, because we can all get caught up in how do things work where we are, that sometimes hearing from the way things work in other parts of the country, it helps us inform ways that we might push for different things to happen. And so my team at LSS has been working to shift that dynamic within all those tables. And so, you know, our first call when we found out the grant was funded was to our system partners at the state level, because we know long-term support and sustainability for this kind of work is going to have to come from government. It's this public-private partnership kind of thing. And so we have been lockstep with those partners throughout the course of the project to keep them updated, to help them understand what we're seeing in terms of results for the families and the young people that we're working with, and also to lift up that race equity angle. And make sure that they're understanding this is a focus of our work and how that can help inform our approach as an organization.
And I would just add to that, building off of what Rebecca and Renata have been saying, in terms of being able to see beyond just the initial implementation of a program, or waiting until you're asked to implement a program by the system, or a system seeing the necessity of it. Having that grant funding to really not only add a much needed resource and program within the communities, but to really leverage that as an opportunity for systems change and to help system leaders start to think differently about what's possible and what is truly, you know, what families are truly capable of, and what is possible if you shift resources and shift your mindset. So sometimes we have to help people see something different happening in their community in order for them to believe that something different is possible. And then if you're beginning that from the very beginning of the journey, then the goal is that you can help scale that more broadly too in your community through many systems partners and up through systems leaders, so that people begin to believe that greater things are possible. And if they shift resources and put more emphasis on that, supporting that then it can happen. So that way, then ultimately that behavior shift and those resources shift starts to happen.
Thank you. Thank you, Sheila. So we have the toolkit. I'll just lead off with one other additional, question, and then we'll go to questions that have come to our participants today. So when you think about the toolkit itself, what's your vision for how others can use the toolkit? What are its major contributions, and what might I, sitting out here as a director or planner or funder or anything like that, can get from the toolkit itself?
Go ahead, Sheila.
Sorry, Renata. I can go ahead and kick us off. My hope is that people use the toolkit as a pathway to create more opportunities for people in multiple arenas to see how something can be different and to serve as a leverage point to shift broader systems, beliefs, policies, practices, and ultimately resource and shift power to families so that something different can truly be occurring for all families in their communities and equity can be achieved.
I think one of our vision is for the toolkit to be practical, but be also ambitious at the same time. And so on the practical level, really, like Sheila said, envisioning organizations using it as this guide to really measure these equitable outcomes, these programs that are focused in that way, and to be able to use it as this roadmap with these actionable steps that are in there, and really focusing on the collaboration of other partners. Maybe it's not other states, but maybe it's other partners, other departments within your organization. Just that collaboration really promotes innovation, and really looking at that. And then on a national level, we want it to extend beyond the individual organizations. We see this as information for grant makers and funders to know what it really takes for to change a system. It takes time. It takes intentionality towards these goals. It takes a minute to stop and to ask the right questions at the right time, and then hear what the actual answers are, not what we think the answers are, but really engaging the community in a way. And so we're really hoping that it will inform all of that, so that as we're doing this work, we are supported with the right resources, even beyond funding, but we're supported with those right resources to be able to do this type of work.
Mm-hmm.
And I would just add to that, it also, I feel, gives the courage for organizational leaders to take a stand on really important issues and to believe that you have the capacity to make change within your community if you step up to the table, and that you have a voice that's relevant and important, which is so necessary if we're going to see things change.
Right. It really provides that foundation. And we heard that when we talked with other participants in the FSI. So thank you for raising that. And we'll go to questions that have come up in the question and answer.
So we have several questions about data. So I'll ask them together because they're all very related.
Okay.
Elizabeth says many states struggle with accurate data collection on R/E of families. So having a clear sense of the disparities is difficult to have. It's difficult to have a clear picture. So she asks, can panelists discuss how data is utilized in the FSI model? What data is collected and how is it monitored over time?
I think, Sheila, you would be a great person to start us off with that.
Absolutely. I'll go ahead and start us off. I think that's a great question that people are lifting up. A lot of times data is available. However, it can be challenging because sometimes folks are worried about sharing it broadly. And so part of it is asking, part of it is partnering with your collaborators and getting the best available data that you can. Originally start with what you have. So you have your own data that you know from either people that you are serving from your community and the disproportionality of those that you're serving in your community that are being referred to your programs, or that you're seeing in foster care programs that you may be operating. And you also have several community partners, so you can collaborate to get your own data too, and share with each other, like, what is this looking like in our community for those that you're serving or the referrals that you're getting? But also partnering with your system leaders within education, child welfare, juvenile justice. People have data. I think sometimes it's around how public are folks willing to make it, because it calls for some vulnerability and some trust. And so sometimes it takes that relationship building over time or building the capacity to be able to begin to gather and share that data and trust with what you can do with it. And I would say a big piece of that is to underscore your shared interests for children and families. You're not there to, give somebody a negative headline in the newspaper. You're there because you want to know if what you're doing as an organization and what you're doing together in your community is really working for children and families, and you want to monitor and be good at what you're doing so that you can be making it better. So if something needs to change, you want to know if your changes are making a difference. And I think that goes a long way to also establishing that trust that you need to get that data sharing starting to flow.
I mean, what you said, Sheila, I thought was brilliant. Relationships, particularly with system partners. And I'm not going to profess that we have it completely down, but those trusting relationships with individuals who are operating in systems that have shared interest, it can help propel them to be open to sharing if they know it's not just a bomb throwing activity. It's about how we understand who we're serving and how we can serve them better. And then that vulnerability of sharing your own data and saying, we know there are disparities in our data too. And that can help open the conversation.
I would also add, never let the lack of data be a barrier to doing this work, because all of you, I'm sure you're on this call because you have a ton of experience and a ton of knowledge in this field. And you have observations, from your own expertise where there are disproportionalities, where there are barriers within systems. And it's not only about quantitative data, there's also qualitative data. So you can go interview people in community, you can do focus groups, you can do outreach, you can do surveys. There's a number of things you can do to gather data, but I would just encourage you to never let the lack of data be the barrier. There's always an opportunity to gather data to begin doing something.
Most of the questions, I believe, did have to do with data in the question and answer. So it could be that we've covered that, and we really appreciate that. Anything else that the panelists want to mention about data, feel free to chime in. Otherwise, or if anyone else in the participants, something else has come up for you and you have a question, we can probably take one more.
I would add one thing about data then, since that was a popular topic. Find what data you can. Usually the data exists on a state level. So if nothing else, begin with what you've got. Using the kids count data can be very helpful. Their AFGAR's data is very helpful. There is a lot of data around, at least at a state level, where you can begin with that and then just try to drill down within your community or what you see or hear from that qualitative data in your community. So just reinforcing, begin with what you have, but never let it be a barrier.
Great, thank you for adding that in. Okay, we'll go ahead then, I think, and close the question and answer and the panel. We so appreciate all of the panelists that have been with us today, our discussants, and of course, all of you who have joined the webinar. And we want you to continue this journey with us. And so I'm going to go ahead and let Renata speak about an opportunity to do so.
Absolutely. And so this was just a portion of the work that we're doing. It's a portion of all the work that we're doing. And so we want to be able to lean into additional aspects that will bring this all together. And so as we build on this work into achieving equitable outcomes, we're hosting a free in-person convening, Unlocking the Power of Lived Expertise, November 14th through the 15th in Chicago. There should be a link in the chat as well as the QR code on the screen. And so whether you're a direct service practitioner, a community leader, an executive, a volunteer, all of those things, we invite you to join us for this transformational convening that will be hosted by Bethel New Life, where Sharif Walker is the CEO. He'll also be a panelist that day. And so we'll be led by Dr. Carle from Spark Learning Organizations and other peers to really co-create a space where we can listen authentically and recognize the power of lived expertise. We'll explore ways to infuse and value and how we engage people with lived experience and expertise throughout our work. And our panel discussion will be led and moderated by Dr. Ann Farrell, who's a senior research fellow at Chapin Hall at the University of Chicago. So it'll be an awesome time to collaborate with other people around this topic and really advance our work. And so also other ways to join in with Lutheran Services in America is by visiting our website at lutheranservices.org and reaching out to become a part of our community as we work to shape the future of children in equitable ways. And far greater, we invite everyone to just be change agents in the work that you're doing where you are in those communities, because that is how we really move the needle together. We have this goal of helping all families and supporting all families. So the individual work that we're doing will really lend and support the work that we're all doing. And that's how you get systems change.
So this is the QR code to access the toolkit. And Isabel already put the link in the chat a few times. And so we just want to say thank you one more time, everyone. And this is some more information about connecting with Chapin Hall. Thanks, everyone.
Thank you.
Thank you.